Good morning, Dr. Eric Klajinsky here at Fanwood Back Relief Center. It's Monday, we're back in the office, and today we're going to talk about whiplash injury and the use of a soft cervical collar around the neck. So whiplash occurs most commonly when somebody's in an automobile accident. Either a front end or rear end collision causes the body to jar forward and back and creates like a snapping motion of their neck. Now, a lot of times if you've ever been in a car accident or if you've ever seen somebody that's been in a car accident, when the paramedic or EMTs arrive, one of the first things they do is put a cervical collar on the patient. Because due to this type of injury, they're not aware if there's any type of fracture, something majorly broken or displaced in the neck. So it's precautionary in nature until they can transport that patient to the hospital, get the appropriate x-rays, do the appropriate test to make sure nothing severely is injured. And that's fine. That's the complete normal protocol and how things should be taken care of. What does happen though is greater than 80% of these patients leave the hospital, the emergency room, with another type of collar, which is a soft cervical collar. It's kind of like a foam cushion that goes around the neck. Sometimes you see people walking around at their grocery store, at the mall, after they've been in a car accident. And like I said before, greater than 80% of these people that leave the hospital have these cervical collars on. And there's more and more research piling up, showing that this is the wrong course of action. And the reason being is when they research these types of injuries and people that do get prescribed this soft cervical collar, they're 4 times as likely to end up back in the emergency room within 3 months. And the reason being is because active rehab after a whiplash injury, as long as nothing is fractured or majorly displaced or broken, active rehab is the best course of action. So preventing movement by creating that cervical collar where the patient's unable to turn their head or has limited mobility and function actually delays the healing process. It creates more and more stiffness, more and more pain, and just further regresses any type of rehabilitation and healing with that patient. So the proper course of treatment is if you are involved in an accident and you do receive whiplash injury, you want to get to the chiropractor, get to the physical therapist, you want to stretch, you want to exercise, you want to mobilize, you want to move. Because in order for those tissues to heal effectively and not develop a lot of scarring or restricted motion later down the road, it's important that those joints and those muscles and those other tissues are moving properly as quickly as possible. So stretching, soft tissue therapy, chiropractic manipulation, all these things have been shown through the research to speed up recovery and have better long-term outcomes in terms of proper healing and rehabilitation. So just some thoughts there. So if you are in a car accident and you do go to the hospital, refrain from getting any type of soft collar or using a soft collar outside the hospital. Get to your chiropractor, get to your physical therapist, get the proper rehab. It's important. The timing is so crucial. The longer you wait, the longer the process it is for the rehabilitation and for the healing to occur. Any questions about this video or any other topics on our website at fanwoodbackrelief.com, shoot us a message, give us a call, and we are happy to help. And hopefully you have a great week, and we'll talk to you next week. So long.